Welcome to UT Southwestern's What to Know. Pregnancy during a pandemic, perhaps the last thing you'd be expecting when you're expecting. Joining us today to talk about what's best for mothers and babies in these extraordinary times are Dr. Shivani Patel, a maternal fetal medicine specialist here at UT Southwestern, and her patient, a new mom, Katandra Bird. Thank you for joining us. So Katandra, you found out very early in your pregnancy about COVID-19. Tell us a little bit about what that was like for you.
I honestly kind of brushed it off in the beginning, and then I got to the point, I think a few weeks down the line, that I really realized that it was something that was very serious. It was moving faster than obviously any of us had expected. We were going to the doctor once or twice a week, and everybody kept asking if I was taking precautions. And I just, after a couple weeks, like I said, I just really realized the importance of it, as far as keeping us both safe, making sure that I didn't get sick, because who wants to go into labor sick or be pregnant and sick at the same time? It was tough. It was definitely tough once we really realized how serious it was. And we just wanted to obviously keep both of us safe in the long run.
And Dr. Patel, the relationship with your physician is really important to new mothers. How has your practice changed during COVID-19, and what's it been like for you in terms of delivering babies and being involved in the care of your patients?
Absolutely. I think since mid-March, we have had to change how we deliver care to our patients. And the biggest change for us has been utilization of our telehealth platform. We reorganized our prenatal care schedule based on recommendations from the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine, allowing patients to really only have to come into the office if they needed a physical examination, or we had to do an ultrasound examination of their baby, or lab work. Otherwise, we were able to conduct the rest of their visits via our telehealth platform. And I think that provided them great flexibility and convenience, while also ensuring that they were limiting their exposures outside the home.
So Katandra, tell us a little bit about what it was like, your experience when it came time to have your baby.
So it was very unique, very much a surprise. We went in for our 39-week appointment, and we were actually expecting to pretty much have to decide whether we were going to do an induction or just wait for a baby to come. And Dr. Patel actually sent us to the hospital. When we got there, everyone had on masks. So every doctor, every nurse that came in, they had on masks. They made everybody wash their hands, used hand sanitizer like crazy. Definitely made us feel safe, like we were being taken care of. So going in, Dr. Patel did warn us that the first thing we were going to have to do was get tested for COVID-19. So both my partner and myself got tested. I don't think that the hospital really skipped a beat when it came to, just making sure that we were comfortable, we were taken care of, and that we had the experience as best as, it could really come down to. So very grateful about that.
And Dr. Patel, tell us a little bit about the way the labor and delivery unit is organized to make people feel safe.
Absolutely. So as Katandra pointed out, that all of our patients are screened for COVID prior to delivery, whether that is someone who is scheduled for delivery and gets tested ahead of time, or even if a woman comes in labor, which happens all the time, they get tested when they come to the unit. That way we know what everyone's status is, whether they're positive or negative, and we can take the appropriate precautions on the unit. All physicians and nurses are wearing masks and goggles or some sort of eye protection at all times. And in taking care of patients who are positive for COVID, we have extra safeguards around them in terms of the types of rooms we use and having extra nurses involved in their care.
And Dr. Patel, what additional advice do you have for women who have a high-risk pregnancy? You might tell us what a high-risk pregnancy is and what advice you have for them.
Absolutely. So, every high-risk pregnancy is different. And I think one of the important things for patients is to understand from their doctor what makes their pregnancy high risk. If your pregnancy is high risk because of a fetal condition, then it may not necessarily be high risk from a COVID-19 standpoint, versus a woman who has underlying diabetes or heart disease or lupus would be at higher risk were she to contract COVID-19. And so I think that it's important for patients to understand what makes their pregnancy high risk and whether that actually has implications for COVID-19. And then just remember the same social distancing, avoid large gatherings, wearing a face covering, and good hand hygiene.
So Katandra, what have you learned from your experience, and what's the advice you would give other moms?
I could make a huge list of the things that I've learned, right? From being a new mom to being a new mom in COVID. We already, as women, have that opportunity to experience postpartum depression. And I think it's very important to be open about that, really being aware of what your body's doing and just being willing to talk about it, because there's so much going on in the world. The last thing that you want is to let something, pass by without being willing to talk about it.
And Dr. Patel, COVID-19 has added a layer of complexity to all of our lives. What additional advice are you giving to mothers as they think about becoming pregnant or being pregnant?
It is important that you have a conversation with your partner and your family. And is this the right time to have a baby? Understand the implications that COVID-19 will have on your pregnancy. It will not be what a quote unquote normal experience will be in terms of baby showers and gender reveal parties, your ability to go out and shop whenever you want to shop or without wearing face covering and social distancing. Women just need to be mindful of that. And I think if you go into it knowing that your expectations probably have to be altered a little bit, then I think women can still have the experience they want.
So, Katandra, you're a veteran mother now, and so what are other moms asking you? What are they curious about in terms of being pregnant, and particularly about the time of delivery?
I think the biggest thing, people were worried about, what the COVID actual screenings like, as far as those of us that haven't had to go through it. It was a little uncomfortable, but, it was definitely worth knowing that, whether you have it or not, and definitely keeping yourself safe and everyone else in the hospital.
So, Dr. Patel, I always ask the doctors that appear on the program what they're doing to keep themselves and their families safe. Tell us a little bit about what you're doing.
We are a family of 4. I have 2 young children in elementary school. So we are doing, all the things that are recommended by our infectious disease colleagues. And that is, we're practicing social distancing. We only really go out when we need to. Everyone has a face covering, and everyone knows, including my kids, that if they get in the car, they got to make sure they have their mask with them. And then just good hand hygiene.
Thank you for being on the program today and for all the great comments. Thank you so much.
Awesome. Thank you, guys.
Congratulations, Katandra.
Thank you very much.
Thanks for watching. All the topics for What to Know come from you. So if you have ideas about things you'd like to hear from us, please email those to us at whattoknow@utsouthwestern.edu. Until next week, stay safe and stay healthy.